Well, hello again, KCIW listeners, and welcome to Curry Cafe. I'm volunteer Rick McNamer. Every Sunday from 3 to 4, your host Ray Gary and I put together a panel of guests to discuss various topics of interest that impact our wonderful community. Listeners can participate by texting questions or comments to 541-661-4098. Again, that's 541-661-4098. Now, before I turn it over to our famous radio personality, just wanted today is Happy Winter Solstice Day. So from now on, we're going to enjoy maybe a little more light each day rather than plunge into darkness. A few seconds at first, and then up to 3 minutes by hopefully January into February. And also, midst of holiday season, just like to wish everybody Merry Christmas, Happy Hanukkah, Happy Kwanzaa, Happy New Year. Let's hope 2026 will get brighter as the days get brighter. There we go. Ray,
all right,
it's all yours.
You're happy to. You didn't acknowledge the people who don't acknowledge any happy. Never mind.
Everybody.
Oh, what did didn't Seinfeld have a
Festivus.
Festivus. There you go. Okay.
Festivus for the rest of us. There you go.
Okay, being the 21st, that means this is the shortest day of the year. I woke up this morning all happy to realize that starting tomorrow, my electric bill will be going down.
There you go.
Less need for lights.
Good news.
Yes. Okay, I'll turn the microphone over now to our guest who will introduce herself and tell us what it is she wants to talk about today.
Hi, my name is Gabrielle Wired, and I am somewhat new to the community. I've been here about 2 years. I came from Virginia, where I own and operate substance use mental health medical practices. Being in recovery myself for about 23 years, I've studied a lot of things of what makes us tick, how our minds work, or maybe rather not work all the time. And, the struggles that I've had, even at 62 years of age and going through life, I've learned something about what's called epigenetics. And that's going to be what we're going to talk about today is epigenetics. But before we jump into that and more historical background, before we get into all of that, I have over the years become a sound healer. And I brought a couple of sound bowls with me. And what we're going to do now is just kind of clear the space, get energetically, clear our aura, and welcome the winter solstice as well as
Awesome.
the new beginning that happens as of today. Everything comes back anew and fresh. And so that's how we're going to start. So first thing you're going to hear is this is liquid sage. We'll spray this around a little bit. This clears our space completely. And then I would like for everybody just, if you are sitting down, just take a deep breath right now. And just go, and exhale, and take another deep breath. And another exhale. And a third deep breath. And now we're going to welcome our bowls. And another deep breath. Okay, we have now sufficiently cleared our space. And for those of you who may or may not be familiar with sound healing, but frequencies and sound have been around for ages. Our old church bells that we had used to vibrate at 420 hertz, which is the 420 hertz is where we are in our best space. and can receive input from the universe and really grow and expand. And so that's one of the frequencies that we really like to step into. But all of sound frequencies, we're all frequency. And when we absorb frequencies, healing occurs in the body somatically. So for those of you who have maybe never had that experience, check out any sound healer here locally, as well as myself, and get a sound healing session in.
Well, that was wonderful, and what a beautiful sound. But tell us a little bit about the bowls. These aren't just these are special bowls that you have.
Right. So, well, I like several different sources for my bowls, but the main source I like for my brass bowls is a store called the Om Store. And the Om Store, these bowls actually come from Nepal. They're handcrafted, hand-hammered, handmade. And each bowl is one of its kind. There are no two alike, although on the frequency spectrum they are, but in terms of the engraving that you see, it's not. So
And
you
it's
can kind of
beautiful.
see,
They are
they're
beautiful.
gorgeous.
Yes.
This was actually my very first bowl that I ever got years ago, and I was in West Virginia at the time, of all places, and I picked it up in this place where this gentleman had a store, and he was from Nepal. And I was at Gold Beach. I took this with me. I like to go take these out in the woods and whatever. But I actually dropped it, and it broke a little bit.
Oh.
But it still works. So this has more. This particular bowl has even more
Meaning.
of a connection.
Yeah.
And then I have these thimbles that you see, and these I actually purchased right here in Brookings, Oregon, from a person that sells these kinds.
What do those symbols remind you of?
Symbols.
Well, our favorite movie here that we love to talk about is Plan 9 from Outer Space.
Oh, so right.
And that has flying saucers, and I think that's
Flying
exactly
saucers.
what
I
they
guess
use.
you could say that.
Yeah. Oh, well, that's good. I had a sound session actually yesterday, and I was, at the pickleball, Cascadia Pickleball, and Christine gave a sound session. I hope I remember the name correctly. I'm sorry, I'm sometimes horrible with names, but it was my first one with this teacher, and it was just amazing. I literally went into a trance, and
Awesome.
and that's kind of what can happen to you when you are in the space. You literally could lose yourself. I literally for a minute didn't know where I was. So like, where am I? And I pulled myself out of it, and I kind of shouldn't have, because that is where, again, the healing occurs, when you can go into that trance-like space. And people talk about those experiences, which are very healing and very amazing. So that was
Right.
very cool. Yes.
And another visual, since we're on radio, that the bowls that you have, I would say roughly soup bowl size. But you have very large bowls.
Correct.
also.
I have the chakra set. I have larger bowls. I'm eyeing a foot bowl, which is definitely like 20. I think it's even bigger than that, 20 inches, maybe even
Okay.
larger. They can get quite large depending on,
Yeah, okay.
and then the sound changes,
Right.
it's very deep, or it could be, the smaller ones tend to be higher on octave, and
Yeah.
the other ones tend to be lower. So that's kind of where you can, where they fall different on the spectrum. But yeah, I have all sorts of equipment, actually, the singing bowls and the cymbals, and then also things that make rain sounds, just a whole bunch.
And that's just I know a small part of your, I'll call it a business, but and how many bowls do you have?
Oh gosh, probably, if I had to count, maybe 20 or 30.
Wow,
Just on the
okay.
bowl side, I also have a gong. And I'm always adding. I just bought a drone flute, but I can't quite play it yet. I have to
Okay.
learn how to play it. It would be not so good if somebody heard it right now. But it really, they only have 4 holes. The drone flutes are a little different, and so you don't really have to have musical talent to play it. But I still want it to at least sound good. I have to practice a little bit more on that.
So again, we're talking sound healing. Again, just a small part of what you do.
That's a very small part of what I do. Well, actually, it's not so much a small part; it's a part of what I do. So
Yeah.
what I've trained myself in over the last few years is in the vein of healing myself is the sound healing, psychedelic facilitation. Currently, I offer setting the intention and also doing the integration piece on the back end. And the other thing I do is work with gut microbiome. If somebody works with a functional health professional, gets those lab works done, and needs to be guided through how to implement the dietary suggestions, then I come in as a coach to help people do that. And I myself practice functional health and functional medicine, for my own self, gut microbiome, because we are a system and it's all connected. And that's what a lot of times in medicine, or at least previously, more so now, we're seeing a shift. We're not looked at as an entire system. It's always they're picking apart. Oh, you have this ailment. We're going to treat this ailment. We're going to go here. We're going to go here. But what we fail to do is actually treat the whole body. And there's more to it. It's the mind. It's the body. It's the soul. It's everything,
Mind,
right?
body, spirit.
Mind, body,
suppose.
spirit. And how we are affected mentally. I would say this: we live in our heads, right? I think all of us would agree that most of the time we sit here, we think, and we react. We really live in our heads. So how do we, and that's where depression comes, whether you're happy or you're sad. So then how do you affect that in a positive manner, when we're constantly drawn into these vortexes of life, right?
Yeah.
So, and then making the connection back into our past where things originate, really,
Which is the kind of the core we talked about, epigenetics. Is that right?
Correct. Yeah. So the epigenetics. So, just again, as I embarked on my own healing, about 23 years in recovery, and then the last 20 years, I've worked in the medical space, owned and operated this medical practice, and I've seen a lot of suffering. I interviewed a lot of people. I noticed that everybody shares common traumas and seems to also have the same outcome, when it comes to addiction and so on and so forth. And then early in my recovery, I was saying, there's a cause and effect, that I didn't just wake up one day and wanted to, ingest large amounts of substance. That was never the goal. I mean, that's not how I was raised. That's not what I wanted in life. But yet, I ended up there.
Yeah.
And then, I ended up cleaning myself up, basically, decided that I didn't want to participate in that lifestyle. And it wasn't that I was in a crazy scene or anything. It was eating at me. And as I did that and started to go to meetings, this, that, and the other, and it was always this, you did this wrong, and we kind of beat ourselves up. But I said, well, there has to be a cause and effect. What was the cause? Well, nobody could really answer that. So years of therapy, all the things that I was looking into never really gave me the answer. I was still not better. As a matter of fact, things got worse in some sense. My ADHD became more progressive, and I just didn't understand. I kind of got lost. And then last year, it was pretty bad. I actually at some point didn't necessarily want to be here. Right? I was like, okay, well, what is all this? And I started to really look into epigenetics and the links to epigenetics by reading several books. And I came across the first book, which was In the Realm of Hungry Ghost by Dr. Gabor Mate. And that was an eye-opener for me. It was the first book I read that mentioned the word epigenetics, which I had never heard before at the time. And, what it really is, epigenetics explains how trauma, such as stress, trauma, environment, substance use, and how the genes actually express themselves. We have DNA and then we have RNA. And our DNA doesn't really change, but our RNA and how our genes express themselves can change by outside influences, or even genetic influence, or even historical influences from our ancestors, generational things that can happen that you don't even know happened. Something happened to your grandmother, and then it actually affects you in this lifetime. How would you ever know that? Those links were never made, at least not when I was in therapy. Nobody's really explained it.
I'm going to jump a little bit here, but does that kind of equal? I'm thinking Darwin. I believe you and I have talked about it a little bit before. How you change because of your ancestors, or you evolve, I guess, but also maybe carry previous trauma. So yeah.
Exactly. Yeah. So there are a couple of examples, I should say, and one particular one that I want to recall is, and by the way, I know I told you guys the story before, and I think I was a little bit incorrect in the actual sequence, but here's what
Okay.
actually happened.
Okay.
So this 19-year-old came to the doctor, and he was just had insomnia, couldn't sleep, and just couldn't understand why he couldn't sleep. Had gone to different therapists, and had done all the tests and got on some antidepressants, but really nothing worked. And then he came to this therapist, and at this point he's 20, and it was really at his wit's end, couldn't quite understand what happened and why he couldn't sleep. And so he described, that he was, one day, he was 19 years old, and one day he wakes up in the middle of the night at 3:30 in the morning, and he was shivering cold and could never go back to sleep. And this was the permeate every night, and thereafter he had that same thing. He'd wake up at 3:30 and then couldn't sleep, and and he was always shivering, and he had this fear that if he'd go back to sleep, he wouldn't wake up again. And so this therapist then finally said, well, okay, was there anything in your history with your family, that you can point back to where someone might have been, had a problem with sleeping, or something happened to them and they were cold in the night or whatever? And he said, yeah, his mother had just recently told him about an uncle that had been in the snow, had gotten lost, was in the snowstorm, and had basically gotten cold and then passed out and had hypothermia by the time they found him, and then he had passed away. So, and nobody ever really spoke a lot about this, but that was the actual trigger. He was 19 when it happened, and so although he had no direct link, this has carried through the gene pool.
Yeah.
So that is fascinating, So we're talking about how the male's sperm carries ancestral data, how the women's eggs carry ancestral data, and then when people come together, then the children, actually can display whether that's PTSD, whether that's depression. It's good or bad, right? But
Yeah.
there is this effect. Well, we had no knowledge of that, so. The studies are showing that when children are exposed to stressors in utero, and when they are born, they can already have depression and PTSD and grow up with that. And then people go, why is that going on? And there's this child had loving parents, for example, like they're in a household with loving parents. But what nobody was aware of, for example, that the mother was exposed to 9/11. There's actually a particular study that was done you can find out about, where they really observed the mothers that were stressed and the children that were born and what happened to those children right after that. And that's where you could really see that.
These are children that were
They were
were
In utero?
yeah, in utero.
Yeah,
yes,
right.
At
The
the
mothers,
time.
right. The mothers were pregnant, and as early as pregnancies at 17 weeks of age, when the baby's even 17 weeks, they said when there's they're just the data was suggesting, in utero is they were picking things up from the parents. So when you think about just that, even on a global scale, when you think about a mother is stressed, I mean, previously I was reading, if a mother is stressed in the third trimester, then these things occur, but now we know it's even before that. But when you think about that on a grander scale, when you look at trauma, when you look at stressors, when you look at all these things, what mother isn't stressed in the third trimester? Or even, if a mother, if you experience violence, whether it's sexual violence or whether it's physical violence or whatever it is, this impacts the baby that is still in utero. In some cases, when there are severe stressors, wars, whatever, these babies are born sometimes with their thumbs sucked raw.
Oh.
Yes, they have so much anxiety that by the time they pass through the birth canal, this has already happened. And yeah.
I'm sorry, does past lives enter into your thinking at all? Or?
I personally believe in that. I haven't yet seen the tie-in with past lives in the books that I'm reading. Let's put it that way. But I personally think that we do circle through. Some people may not.
Makes
And
sense to
you'll
me.
carry over problems from past lives into new.
Possibly, I mean, maybe that's the part that's missing here, that maybe the scientists haven't put linked together yet, that maybe we are actually coming back through, right? And maybe that is the true epigenetic. I don't know.
Yeah.
But the way that they're talking about it now is, just a new baby, a new sperm, a new,
Right.
but because of that ancestral trauma that happened to someone, and in particular, for example, Holocaust survivors. There's another story of a young woman that I just read, that she was, she was depressed from the moment that she could remember, and nobody in the family could understand why, and she just didn't want to be here. So when she was 39 years old, she went to the therapist. She told the therapist, I just don't want to be here anymore. And she said, I'm going to commit suicide. And the therapist was like, what? And she knew how she was going to do it. She said she was going to jump in to an incinerator where her brother worked in a mill, in a steel mill, because she would, just eviscerate completely. And wow. Well, what had turned out is that her grandmother had come over after the Holocaust, and she had seen obviously she had seen the smoldering, all
Yeah,
experienced
the
all of
horrific.
that, the horrific experience of incineration. And but also that this was kind of hidden from the family. They didn't talk about it. And so she had no real knowledge about what happened. But that ended up really being the link. And the other part of that was that when you come through this type of trauma, it mimics PTSD, and PTSD, unlike other stressors, which are saying high cortisol, is linked to something called low cortisol. Those are some newer studies now coming out that there's actually low cortisol, which are more likely linked to PTSD. And again, so when we're not aware of these things, we miss treatment opportunities.
Yeah.
And so whether or not a provider today is looking at this new data and incorporating that into therapy, or finding out what is your core trauma. I'm 62 years old, and when I decided to get help, I realized, I didn't have this information. And I think that in the younger generation now, there's more information in therapy where maybe you're aware of it. But I think our older generation really struggles still, and maybe not even is forthcoming, just struggles in silence and going, okay, well, I don't feel good today, or I'm depressed, or I'm this, or I'm that. I just put one foot in front of the other. I'll make it work.
Well-
But the self-talk is negative and all of this. Well, that's where all that kind of comes from. And how do you switch? How do you turn that around? That's what
Right.
we're trying to do. So when we talk about epigenetics and what it really is, it's the expression of your genes. So it's not your DNA changing, but your RNA and your gene expression. So for example, if you smoke cigarettes, you may end up with cancer, right? And why is that? Because over a period of time, you've subjected yourself to an outside source that then changes the expression of your genes, either turns them on or off, and that's how you end up with disease most
Yeah.
of the time. So, yeah.
And by the way,
Mm-hmm.
if you people remember, you can text in questions or comments.
Mm-hmm.
Gabrielle has a wealth of information, and the number is 541-661-4098. And thanks to Gabrielle, you said you hadn't heard of it
Mm-hmm.
released for a while. Well, I never heard of it until talking to you and
Mm-hmm.
did a little research. It's been around longer than I thought.
Mm-hmm.
Now, the name I came up with was a Conrad Waddington,
Mm-hmm.
who apparently coined the term in 1942.
Mm-hmm.
So it's been around at least that long.
Yeah, I think it's been around, but it's also been considered in the medical jargon as junk science for the longest
Well,
time.
here we
Yeah, because but that
You
you
can't see that under a microscope, so it
Yeah.
doesn't exist.
and we always like to follow the money. Somebody was probably
yeah.
not seeing how they could benefit from it, or I don't know, right?
Right.
When they talked about, our DNA, only about 1% to 2% of human DNA codes for protein, because we have what's called an non-coding DNA, which is what changes. That's the part that does change. And so we have the remaining DNA plays a regulatory role, acting like switches, dimmers, timing controls that influence when and how genes are expressed the epigenetic mechanism primarily acts here. So, the turning on and off of genes. That sounds like jeans for pants. I meant jeans.
She's got good genes. Have you seen that?
Yeah, we got some really good genes. But why gene expression matters is because influencers like stress response, sleep, moods, immune function, inflammation, and disease risk, all of this is part of why epigenetics matters, right? It shapes the baseline of the nervous system tone and its reactivity. It does not determine the destiny, but it does set operational conditions for how we function, right?
Yeah. Would it be part of like biology?
Mm,
Going wrong there, but it kind of sounds like
It may at some point, I would think, but right now we don't have the ability to study it.
yeah, but
Cells at that
Okay.
level. But
okay.
there are some new studies now, and I've done some studies with mice. One particular study said they did. Mice are most closely related to humans, I guess, in terms of how they react to certain things. But what they've done is they took a scent, and they would have the pregnant mouse, they would give her the scent, and then they would stimulate her with something that she didn't like a pain response or whatever the noise, whatever it was, and then when the baby mice were born, even though they had never smelled the smell, when exposed to that smell, they would have a similar reaction, and so that, those are some of the tests that are being run now. And now we're doing human trials where they're starting to really link all of this together. So biology, obviously, because we, somewhere I would think has a play in it.
Yeah,
But,
how our bodies react to
Right.
something like that.
Mhm.
Aromatherapy, do you include that in your practice?
Well, I would say aromatherapy in the sense I sage, but
Which we
with
did,
the
yeah,
sage,
right.
with the sage.
We had talked about
I have not personally done it, but I would
Okay.
think, I mean, open to anything. It's not something
Right.
I have in my repertoire right this minute,
Okay.
but yeah,
Okay.
I'm always willing to take a look at that,
Okay.
So absolutely. So but the biggest thing that I see with epigenetics is what it promises for us in terms of what we might be able to do when it comes to getting better, right? Because ultimately the key,
We're all striving for that, I believe.
yeah, and also not just getting better, but also getting better, not necessarily with just pharmaceutical medications, right? So we have both. We want to make sure we have everything, all the tools. But I don't know. But I would assume maybe our listeners too. I know most of us would rather not have to take a bunch of pills. We want to learn how can we heal ourselves on a natural path, right? How do we do it? Whether that's with food, whether that's with sound, whether that's, you know, something else other. And what we're learning is with epigenetics that we can reverse conditions or get better, over time. There's still therapy involved and things we have to do to change it, but we can impact just as epigenetics can negatively impact us. The same is true for the opposite. But first, you have to know it before you can address it.
Right.
So,
And you're talking about preaching to the choir. I had my appointment with my doc just a few days ago, and that was one of my. I take a lot of pills at this stage in my life, and I am getting better in certain ways. And that was my top question when I saw her. I said, "Can I get off of some of these meds?" And I was able to get counseling with her. I was able to get off of 3 and got a lot more to go. But yeah, it's just, and we are a pill popping, especially we seniors, I think.
and there's so many things affected where one interacts with the other beyond what would
correct.
be it might be a very slight.
Yeah, yeah.
Well,
No.
traditional medicine, the way that the FDA, for example, approves medications or gets medications through their cycle, is it's specifically to one part of. Let's say you have lung cancer, then they're going to go, this is for lung cancer, right? And
Yes.
then let's say there's breast cancer. Well, we'll go for breast cancer. But what is not done is actually looking at the whole entire system, and so they isolate. And what is missed in most of these clinical trials is all the other things that are part of before the cancer starts.
Yeah.
And so there was a Dr. Brzezinski years ago, and he had found that in cancer patients there was a specific protein missing. And when he started to study this protein and he was able to inject that back into people, that would help people get better. He actually had some of the first cure rates of cancer and brain cancers. Long story short, they really disparaged him, put out bad data, and because he didn't play with the pharmaceutical industry, he wouldn't.
Oh, I think that's
Yeah, he
horrific.
stayed on his own. But one of the things, so they took everything, they took all the research studies away from him and all the stuff. And he's in Houston, right next to the Anderson Clinic, but he was smarter than that. And his son actually went into medicine. He's retired now. But what he ended up doing, he still provided similar treatments, but what he did is he took all of the FDA-approved medications, like from different and he started to put together cocktails, because he said, they go over here for breast cancer, over here for this cancer, but what they're missing is that actually by looking at things together, you can mix things together and have the same result. So he still had the highest cancer cure rates because he would approach from this aspect. Yeah. But you still don't hear a lot about him. But if you're willing, any of the listeners want to Google Dr. Brzezinski, and in Houston, Texas, there's a lot of information. I think the first thing that you'll see is bad information, because that's what they want you to see.
Yeah.
But dig through it. There are some movies out there that's really interesting.
Yeah, research it all.
Research it all. But it really goes to the root of how we treat and how we study and how we FDA approved medications. That's why you end up with so many different medications, because instead of looking at the entire system, it's this. Oh, you have, high blood pressure, we'll give you this. Oh, you have anxiety, we give you this. Or, this in the body isn't right, so you need a pill for that. And, ultimately, that's not necessarily how it needs to be done, but that's how they do it.
Right.
So.
And we are halfway through, so I just want to let everybody know you're listening to KCIW LP 100.7 FM here in beautiful Brookings, Oregon. And I want to
Wait a minute.
Oh, go ahead, Ray.
Oh, we got to give the phone number.
Ray has
People
reminded
out
me
there
to
that
give
are
the text line again.
chomping at the bit to say, "Oh
It's
yeah,
not
well, what about-"
overflowing yet. It's 541-661-4098. And you know what? It's easy to badmouth the pharmaceutical, which I do. We do. But there's a way of working together. But watching. And I try not to watch. I don't have a TV now, but when I'm watching, if it's commercial TV over somebody's, the amount of pharmaceutical commercials every day, it's like they change them every week, just put a different name on them. And I think it's just not a good place to go.
I love the side effects on it.
Oh, I was going to say.
Well,
oh, my God.
Suicidal thoughts, anal leaking, just all this.
And I
some
love
of the
it
pleasant
how,
ones. I know. It is crazy.
what hits me with that is it's like they always say it in the happiest voice.
Yes.
Oh, and everybody's
remember-
dancing. The guys mowing the lawn, dancing and singing. I've never mowed the lawn and danced.
So I remember this commercial, Vesicare. Do you remember the Vesicare commercial with the tubing and the pipes? It's actually, kidney thing, right? And bladder thing, right? And then it was like all the side effects, and then it goes, oh, and death. And it's basically, and my doctor, I went to the doctor, women, we have this thing, night, we get up at night to go pee, right? And my doctor says to me one day, she goes, we can fix that. I said, with what? She goes, Vesicare. I said, that's all right. I'll go pee. Wow. I don't need to die for that,
Yes.
I mean, the side effects are worse than the cure. You listen to it all the time,
Right.
I always, why would I watch a commercial to see to ask my doctor about something? I would think I'd go to my doctor and say, I got this. They know what to give me. I don't have to ask them to prescribe this one.
That's what you would
I've talked to doctors. People absolutely do that and frequently insist on getting that prescription.
Well, and that's why people end up also on a lot of meds, and that's why, doctors prescribe as much, because, of course, in this country, too, there's a lot of this very litigious malpractice and whatever. If you, when you come to a doctor and you tell this doctor, this is the medication I want, even though he might tell you no, 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 and you continue to insist, he'll give it to you just because he doesn't want to be sued.
Well, right.
And then,
for sure.
Yeah.
Then there's the other thing, too, that if you go to the doctor, the patient might feel, well, he didn't do anything because he didn't prescribe a drug. So you get an antibiotic or something that you prescribe that you don't necessarily.
Transactional, right?
Yeah.
So we are trained, and I have to point to here because I'm originally from Europe and I've seen other modalities of medicine being and treatment, but it is this transactional. I need to walk away with something. If I'm coming to you, I need something, either a prescription for whatever, right? And if not, you didn't do your job. So so the United States consumes the 56% of all medicines produced, and this is maybe dated. This is information I read a while ago, but at the time it was 56% of all medications produced in the world.
It sounds about right.
And I mean,
We're number one.
number one in taking pills. And so what this is about when I bring in this epigenetics is really to show and we're going to get deeper. This is just the beginning of scratching the surface here. But what and how does it impact and what can we do to heal naturally, prevent disease? And so the epigenetic piece is kind of like you search for the root and then you back into treatment, whether that's cognitive behavioral therapy for depression, ADHD, or whatever, or whether it is treating the body that has a disease. But it is always going to be super important to understand that epigenetic piece, so our treatment can be affected better and even more targeted. So then maybe more targeted even with medications because we get to the root more.
What would be the thing that could happen in somebody's life that would cause them to say have heart trouble later on? If I'm understanding your epigenetics, something my grandmother did or my mother affected something in my body that gave me a bad heart.
So so one of the things that we talk about when we talk especially about heart problems is when you've had a difficult relationship with parents, one parent. So what they've done some studies and they've come up that if you had a issue with one parent, then you might have you have a 50% chance of having serious illnesses such as heart disease, high blood pressure, anything of that nature, kidneys, whatever. You have a 50% chance of having that. When you've had a difficult relationship with both of your parents, it's 100%. I fall into that category. So that's one thing that we see. Now, why we have maybe a relationship with that parent, I don't know. But that's specifically targeted when you asked me about heart. That was one study that I can point to in terms of what specific event could be that might have happened to your family. I mean, in your family tree, you could ask the question, has anybody had heart disease or has anybody had an ailment or an incident or something,
But that's not what you're not looking for the hereditary.
No, I'm looking for an event of something.
Right.
Yeah, something that happened that then changes the actual gene expression. That's what we're talking about. It's not the gene itself, but how the gene expresses itself and even generationally down the line.
Okay, so somebody's had an event that caused them to have heart disease later on, and so what do you do about that?
So basically what happens either in the sperm or the egg, that memory is transferred to the offspring, they think up to 3 generations. Well, now you have the knowledge, then we have to take a look and see how to reverse that. What is the heart disease too, because there's different types of heart disease, right? I mean, we have, artery, we have this, we have that. And how do you then, heal that, definitely work with a medical professional. And in some cases, it's probably going to be traditional medication. I'm not that well-versed. I'm not a doctor either. But at least we have a trace root. Now, when you're already in the situation that you're not well, then, what I like to talk about is put together a care team. I certainly found myself not well. 2 years ago, almost 2 years ago, when I first got on the road and I traveled, I went to the dentist and got my teeth cleaned. I had a broken tooth, whatever. Oh, no, I tried to get my teeth cleaned. And they wouldn't do it. And they wouldn't do it because my blood pressure was high.
Oh.
All of a sudden. It came out of nowhere. I didn't know what happened, right? And I never had high blood pressure and all this stuff. And then all of a sudden, it came about. Now, there are many reasons why that could happen. And sometimes it's other things too, hormonal changes or whatever. But I kind of fought traditional medicine. I didn't want to take blood pressure medication, because I was reading the side effects. They said, well, you can have a stroke, and if you don't take it, you can also have a stroke. So I have always had every side effect known to man, so I opted not to have a stroke, not to take it. But I also worked with a medical professional when I got to Brookings. Only in the last, I turned 60.
You found one of those in Brookings?
Yeah.
This is a lovely place to live if you're not
is.
sick.
No, actually, but I found a good medical professional here. Actually,
That's good.
she's a women's health nurse practitioner, Rebecca Meek. I'll just go ahead and say her name.
Right.
And at this point, I turned 62, and I decided I'm going to take a look and see what's going on, because I had heard that possibly hormonal changes can also cause high blood pressure. So, but what I've come to, it's not just any one thing. Going back to that. I had recently put together an entire care team. So I'm working with her, and then I'm also with a therapist. I myself get into sound healing. I take sound healing from others. I do it myself, but it's different when you do it yourself and when you're actually a receiver. Getting out of my own self.
Could I clarify one thing before we go on? I didn't mean to say that the doctors or the clinicians here were not good. They're as good as any place. We
Okay.
just don't have enough of them.
Oh, no, I understand. Oh, and I wasn't taking it that way. I think we don't have a lot here. I mean, going on the dentist, and I found a good one,
I just got an appointment with my cardiologist for July
Oh, wow. And that cardiologist is where?
in Medford. I could go to Medford probably
Yeah.
and move that up to June or something.
Well,
Yeah.
sometimes they'll come here once every
That's
month
what-
or so.
yeah.
Yeah.
Or-
I mean, I have the same thing. Before I forget, Gabrielle, I wanted to real quick. You talked. I know you have the European background, which is great. Could you? Of course, it's been a while since you've been back there, I guess. Or
Yeah, actually, I haven't been back since 2022, I think it was the last
oh
time
well,
I was
that's. I
there.
was going to ask
Maybe.
you to do if you could, a quick comparison between the medical things.
Yeah.
Back there compared to how this country does it.
Well, there's
I mean, that's a pretty broad brush.
yeah.
But
Well, for one, we have, universal health care, right? When we have really good health care in a sense. I mean, I wouldn't say it used to be better when I grew up there. Everything was 100% covered. And then
okay.
they took a little bit of the American model and did some splitting of, which was,
Well,
whatever, it happens.
yeah.
But in terms of treatment, very much still very interested in doing things holistically. Food source,
God, I'm glad nutrition.
nutrition.
You mentioned that.
Yes, is huge.
yeah.
Yeah, and just the foods that you get from the farm to the table, the quality and it's just different. So it starts just with that. So when you think about food is medicine, by the way.
Oh,
The-
right.
you know,
Oh, yeah.
the body can heal with the right amount of food. So that's where functional health comes in, right?
Yeah.
So how do we support us? So that's a big part. There's just more. It really is more towards the holistic side. It doesn't mean we don't obviously have chemo and all the treatments as well.
Correct.
Absolutely, 100%. But there's definitely always a part where we're looking at what can we do. Sleep better, eat better, walk.
That's another huge thing, a proper amount of sleep. I know a lot of people that aren't getting good sleep at all.
Right.
And they're all seniors, and
Mm-hmm.
it could be a problem.
It is a problem, and it probably can. It links back to all sorts of things. Whether you're taking lots of medications that keep you up at night or whatever
Yeah,
the case
yeah,
may
yeah.
be. But yeah, so all of that is so when a doctor sits down and talks to you, asks a lot of questions. What I've noticed, okay, what is the difference when I go to a doctor here anymore? Well, I can't say this practitioner because she's wonderful. She's just different. But generally speaking, if I go to a doctor, they don't ask me, how do I sleep? How do I eat? What do I do for myself? Do I have any problems at home? To a regular GP, that's not even it, right? It's like, oh, you're hurting, or you have high blood pressure, or you have this. They kind of go, oh, and here's a medication for that. But actually, why is this happening? Or those questions are not being asked, right? What happened to you? Why is this going on? Those questions are rarely ever asked, and that's probably one of the biggest differences that I would see is just how the actual questions that are being asked by the providers. They might ask you, how's your relationship with your husband and wife, right? And you might go, why do I need to tell you that? But guess what? If you're in a stressful relationship with your partner, if you have trouble at home, if you're miserable, that is 100% where we go to the epigenetics. Prolonged trauma, that is trauma. That has an effect on the body. 100% is how your genes can change. When you're talking about cancers, for example, 100, many times you can look at stress factors that really would be the cause for that, right?
Yeah.
So when treatment happens for cancer, right, we know this, that the people that are positive thinking, whatever, have a better outcome than those that aren't. Again, why is that? Because everything is linked. So that is the thought process, the epigenetics, the continuous imprintation is how the gene can then either express positively or negatively.
Well, I'm glad to hear that epigenetics, it does cover all. I mean, that nutrition is a big part of that. And one little thing that I notice also with people that I've known that have had trouble is pretty simple, but it's hydration with water. We're pretty prone to I was raised on Pepsi.
Oh.
And I'm serious, man. It was my house. We were all known. Hey, come over to the McNamara's. We'll have Pepsi. But anyway, I finally got off of that stuff. That stuff's addictive, man. And
It is.
some friends of mine recently have had a couple trips to the hospital. Why? Because they were not hydrated. So
Oh, yeah, well, I
a
guess
simple
it's-
thing like keeping
Right.
hydrated with regular water, I guess, is where I was.
Right. Water is it. Well, I mean, when you think about sodas in particular, high sugar, all that sort of
Right.
thing. Or if you do diet, if you think about it, diet sodas, right? We think,
I think they're even.
oh, they're worse.
Okay,
They're worse.
worse.
No.
I was in a park one time, and there was a woman with a baby in a stroller, and she was filling up one of those sippy cups with Coke Classic to give to the kid. And I'm like, oh. But at the time, I had stock in Coca-Cola, and I said, right on, baby.
Oh, so you were all money oriented.
Yes.
with your-
Why not?
No, but that
I wasn't going to do anything to save that kid's life, so I might as well make a buck on him.
Okay.
Well, there is I randomly read a lot of different white papers, whatever. But here's another one, for example. Right now, there is an increase of colon and intestinal problems for people born in the 90s, right? So anyone, right.
Didn't know that.
Right. So what was the difference? What's the difference, 80s, 90s, whatever? What happened, right? When this is just my interpretation of after I've read a bunch of things and going back to the epigenetic piece, but that's really when we started to see a lot of baby foods being conveniently served in plastic tube. Everything is
Oh,
prepackaged, squeeze it out. We're talking colon cancer. I mean, people are, born in 1990, 1993.
And I didn't know that. And
If
that
you,
makes
you
kind of
Google it, look it up, it's a fact. And my opinion is simply that because those babies had been exposed to microplastics, all of the different things that are in the packaging.
Wow.
and if I
Okay.
remember correctly, a baby can eat anything we eat if you run it through a processor or something. Not,
Right, they can
You
eat
grind
real
it up.
food. Yeah, make you cook your own and just don't put any salt and pepper on it and
Right.
and put it through the ring. And when they're little and they can't chew yet. But yes, I mean, make your own. If I'm not saying there's not good baby food. There is, but if you can, buy fresh and try to do it yourself. And still, I look now, I see the moms, and I pay attention because I'm studying this. I'm so into this epigenetic thing and what's going on, and I'm looking at it. I said, I see this girl the other day, and she had one of those things, and she's squeezing it out of the tube. And I'm thinking, I know the packaging is better now, but still. So right there, we know. And again, Google it and find out. There's a huge the greatest right now that they see cancers in people in their 30s, and that's, in my opinion, that's where we need to look, because
too.
the exposure to all of those things. Again, epigenetic event means something over time will affect you, and then the genes will express differently, and it either turns on the gene or turns off the gene. And when it turns it on to the wrong thing, this is what you get.
You mentioned microplastics. We've done a couple of shows on that. I think that that's a problem that I hope and I think we need to get under control. Um, And as I'm drinking right from our plastic, I mean,
Well,
but
yeah.
it's really a horrific problem. And we've talked about it where they're finding the microplastics at the bottom of the Mariana Trench in a fish or something like. There's just we're too convenient, I suppose.
Well, we
you don't
didn't know. I don't think, and in the defense of industry or whatever, I think we evolved as humans, right? The Industrial Revolution.
Well,
we,
sure.
we discovered something. We found that plastics are great. We had good things with plastics. I mean, you think about surgeries, right? I mean, we have sterile environments in which we can cut people open, and 80% of the stuff that's being used to keep it sterile are plastics, right?
Oh my
So-
goodness! See, and disposable.
And disposable, right?
Even now,
right.
when you get blood pressure taken, they banned is disposable.
Yeah, yeah. So, but so in defense of science and as humans as we evolved, I don't think we knew it, right? I mean, I don't know that that those things came about and immediately people knew that it was something bad and they were
Right.
pushing it. The problem is once they understood it's something bad, they never corrected or tried to do it different, or at least it's
And-
slow to change.
Yeah, and covering up a lot of this stuff
Right.
and
Yeah.
to continue being
Right.
what am I trying to say? Bad
Yeah. Well,
about it.
in
But
you-
you're right about work. It goes back working together, compromise. I don't know how you want to say it.
Yeah.
But that's again back to epigenetics. It's kind of a using both
Yeah.
worlds, if I will.
Yeah.
Or
Well,
was- you
one
will.
more thing on the food thing. For example, in Europe, you start to see these grocery stores pop up that don't have any packaging. Everything is in bulk, and you go in and you buy all your products, and then maybe a paper bag you walk out with, or you have a reusable or whatever.
Yeah.
But they literally have stores now where there's no plastics, everything. The foods are loose, and you buy them in bulk, or you buy what you need, and then it's packaged in whatever paper bag or whatever for that very reason.
We go to Rick and Mike and me go to an environmental meeting once a month from SOCAT, and it's depressing sitting there while he's telling you everything that's going. But in the back of my mind, I said, "But wait a minute, it's the whole rest of the world that's doing it better than we are." For instance, I learned years ago that in Germany, you can probably back it. It's illegal to sell toothpaste in a cardboard box. You take the tube and put it in a cardboard box and put it on the shelf, and take it home and throw it. It's just wasteful.
Yeah, less packaging. And
Terrible packaging. Yeah.
we try not to, and
Buy a toothpick from Amazon, you'll be throwing away wrapping and
Oh my gosh.
plastic for months.
every time you get a package from Amazon, you wonder what. Sometimes I get something small, it comes in a big box, and I'm like, what is all this packaging in here?
You think, what do I just order? A stereo system, and then it's like you say, a thing of toothpicks or something. It's just crazy.
No, yeah.
The thing is, when you open the Amazon box, it's already in a box that's in plastic and ready to ship. Why can't they just put a label on that instead of putting it in their own box?
Yeah.
I'm sure they would if they could, because that box isn't free to them.
Yeah.
They have to buy that.
Well, and that's another thing. Probably could save money, right? But less cost if we didn't have so much packaging. Bring
yeah.
that down, right? So over the time and over,
There was a thing on the news this morning about the town that What a Wonderful Life was patented after. It wasn't that town, but it has all the bridge and all that same stuff. And
A little homey
wouldn't it-
stuff.
And they told me what a lovely place it is, and then they back the camera off, and at the edge of the town there's a huge dump, and that's off-gassing all the time, and they're looking at expanding the dump. So
No.
not such a wonderful life maybe there.
Well, Gabrielle, back to the
Epigenetics.
thank you. It's hard to say. Just found out.
Yeah.
But and we've mentioned meditation being part of the quote healing. What and does religion, spirituality come into play? It must, because you're going to have different. What do I call? Not patients, clients. You know.
Well, I think for any type of spiritual connection to what I like to say a higher self or whatever, it is
I
a
know
good.
that's personal.
Yeah, but I think so. It depends on the person, and spirituality, meditation, absolutely. It ties in. And I see that when I see people that are very religious too, it really is a tool, right? I think it's a helpful tool to feel better. And, whether one is religious or not, but it talks about in the Bible of generational trauma, the sins of our fathers, 3 or 4 generations. So it's in there. I view the book more of written by people, that they were the first in the know, and I said they knew something, they observed it, they understood, somehow so it's not foreign, it's been around forever. So somewhere in there, people understood that there was this knowledge, and that happens.
Well, it's kind of interesting, like you said. We talked about it. It was back in the 40s when this gentleman came up, but it's really still relatively new to most.
Well, the
people.
epigenetics is new only because it was more dismissed as being something that was useful in healing or treatment or whatever, right? It was kind of acknowledged, but it wasn't really. It wasn't put to use, I would say.
Yeah.
But you will hear the words now more if you pay attention to your news. If you're ever on you'll start hearing. With diabetes, for example, I heard it not too long ago. I was watching the news, and it was a doctor. I can't remember his name, and he said, "And epigenetics." I jumped up. I'm like, "Yes,
Wow.
Oh, now we know."
Okay.
But it's not a secret, right? If we understand what causes diabetes, it's that epigenetics. But what the goal for me, for example, is with this show or with other things that we still want to talk about, is some of the links from epigenetics. I'm going to jump into the next phase of what I would like to talk about one day, is ADHD. And ADHD is often diagnosed or misdiagnosed, but it's a big deal. It really impacts people's lives from childhood all the way to adulthood. It's directly tied to epigenetics. And there's a lot to unpack there, not for today.
Okay.
But that's kind of the lead-in, right? I wanted to share this information, and then we can talk more about that.
Well, great, because we are running out of time.
Yes.
It's a bummer. I wish we had another hour to go, but
Which we can arrange at some point.
Yeah.
Yeah, we'd
But
love to have you
how
back.
about people getting a hold of you?
Okay, so
Let's go.
The best way to get a hold of me is through my website, and it's just communicate@myhumantribe.com, and that is M-I, Human Tribe, not M-Y.
Perfect.
When I founded the company in 2019, if everybody remembers, everybody's about the I with the iPhone, So
There you go.
And so what I actually did when I spelled it, it's M, and then the I is small. Everything is large cap except the I's in the word, My Human Tribe. That particular website needs to be updated to reflect all of the things I do. It has some dated information on it, but it is the best way to get a hold of me via email, because I respond to email the fastest. I think that's, it's just the best way to get a hold of me.
Right. And how long have you had the practice here in town?
I am just starting here, and right now I'm a mobile sound healer, which means I come to you. I am on the coaching side. Just reach out to me. I'm a trauma-informed coach. The sound healing that I do, I work with it from a trauma aspect. It's very, very different, because that's where the rubber meets the road.
Right.
And so that's
Oh,
where you
so
can-
we were lucky enough to get you to visit us today.
Oh, yes.
So-
yes. Well, no, I like to do it for everybody.
Oh, it's
but
great.
But one-on-one is really nice. If I can really work with somebody one-on-one, I really enjoy that a lot.
Okay.
Mm-hmm.
All right. Well, y'all have the information to get a hold of Gabrielle. And boy, thank you for showing up. And we got a lot more to talk about.
Yes, we do.
So
Yes, we
I hope
do.
you'll be back.
I would love to be back. As a matter of fact, I'm devouring several more books on the topic. I continue to educate myself. I work with NIH and several others. I'm just really putting together a plan and more education, palatable, will be on my website in the future too, that everybody can grab. But there's so much more to come that I can share, and I'm excited to do so.
Awesome. And I do believe, maybe I'm not, I shouldn't, I can share it. I think you're talking about hopefully doing a show on our radio
Yes,
program,
yes.
your own show.
I would love to. I would love to. And I'm also very excited if we can, take this further and, and really develop a show and maybe even a YouTube or whatever. Yeah, I'm all in.
All right. That's
Okay,
great.
we're down to 30 seconds.
30 seconds. to
Can
go.
I sign
Yo,
us out?
please sign us out.
Okay, I'm going to sign us out with a little bit of a
Gabrielle,
smile.
sign us out. No better way. Thank you.
Thank you. Thank you for having me.
KCIW LP 100.7 FM here in beautiful Brookings, Oregon. Thank you.
Lots of love.